because I don't have a full-size human available for this project. So we're going to start with his vitals. And let me see, put this on. So first, and I'm going to check first. This is a child cuff. I measured it and it's the right size. I'm going to find your pulse. And I'm going to pump this up until I no longer feel it. And then I'm going to go 30 mercury or HHMG above that to get his actual blood pressure. I just pumped you up, so we got to wait a few seconds between pumping. All right. Okay, ready? His blood pressure is 108/60. I'm going to take this off. Now I'm going to inspect his skin. So I'm looking at him, and I can see that his hair is clean, it's shiny, everything is even. His skin is warm and dry. I'm going to go all the way down, looking at his hands and fingers. Can you do this to me and make a diamond? Ah! He has a diamond here, which is good. It's a good sign. All his skin on his arms are intact, no open areas, no lesions. Capillary refill, under 2 seconds, going all the way down to his legs. He has some little cuts on his lower extremities, which is normal for his age bracket. All the way down to his toes, he has a teeny bit of hair, which just means good circulation. And so that's good. Okay. I'm going to inspect his head and neck and skull, and you can see that he is symmetrical. It's nothing funny. The eyes are even. Nose is central. Can you smile? There's the labial folds, and I'm going to check all the way down to his neck and stay straight. Can you take a sip of this drink? His trachea is even. And I'm just going to watch him do a swallow test. I want you to take the glass away. I want you to do it again, but I want you to kind of look up and swallow so I can see right here. Ah, yeah, I could just see that lift in his trachea, so that's normal. Now, I just want to check. I want to let you look at me. And I'm going to check his temporomandibular joint. So, if you can, I want you to open and close your mouth. Up, yep. Now I want you to go side to side. Oh, yeah. And then go out and in. Yep. So that's full range of motion. And do you have any tenderness there when you're moving your jaw? No? No tenderness? Now I'm going to check his blood pressure here. It's positive. Now listen to it. Positive. Positive. Okay. Good. Can you clench your teeth for me? Clench, like strong. Yes, that's normal. Okay, now I'm going to palpate his nodes, the nodes in his head and neck. So we have the pre-auricle, post-auricular, tonsil, I don't feel anything, submandibular, submental, nothing, it feels good. And then here, oh, I want to inspect your trachea again. I'm going to palpate the trachea. It's not deviated, it's center, normal. I'm going to feel your superficial soon. Here's your superficial cervical nodes, your posterior. anterior. Nothing posterior. Can you look this way? Yeah. And look the other way. I feel nothing. You have no infection. Okay. Good. Now I want you to do, I'm going to check your head for motion. I want you to look this way. The other way. So look straight. I want you to turn like this. Other way. Yep. Go back. Yep. And now go forward. Perfect. Stop the eyes. Andrew, can you please clench your eyes tight? Nice. Can you wrinkle your forehead? Yes. Can you stick out your tongue? And now can you puff out your cheeks? Perfect. Perfect. I'm going to inspect your corneas. Those corneas are white. That's the white part of your eye, right? Can I just lift this down? Those are pink. Your conjunctival sacs. And I want to inspect your pupils. It's bright out here, so his pupils are a little small. And I'm going to check for accommodation and reaction. Look at my finger, and I'm going to just keep looking at my finger. He can accommodate. And your pupil response and your size, and the pupils are symmetrical in size. And they're the same, and irises are blue, and those are also the same size. Now I'm going to test your visual fields for your peripheral fields. So I want you to cover your one eye with this paper. Cover one, right? And I want you to tell me when you can see my fingers. Don't go like this. Yep, just like that. Ready? Tell me, looking at me, I want you to look at me and tell me when you can see my fingers.
I can see your fingers.
Okay.
I can see your fingers. I can see your fingers. I can see your fingers.
All right, now switch sides. Ready? You're going to look it straight at me.
I can see your finger. I see your finger. I can see your finger. I can see your finger.
Thank you so much. And now I want to look at your lacrimal ducts. Let me see. Yep. My hands are clean. Yep, that's perfect. Check Andrew's cardinal fields of gaze. Ready? So I want you to follow my pen. And they're perfect. And now I'll inspect his ears. So the ears, can you turn to the side? They're lining up here. Do you have any pain or tenderness or anything like that? No? All right. Your ears are symmetrical. They look good. I'm going to do a whisper test on you. Okay? I'm going to whisper 3 words. I want you to tell them back to me. Just look straight ahead.
Cake, blueberries, soda.
Okay. Football. Look ahead. Football, baseball, basketball.
Football, baseball, basketball.
Okay, so that's a positive. I did have an otoscope and other tools that I borrowed from a doctor that died and had a house full of equipment, but the wife sold the house, so we can't use this equipment anymore, so I don't have the otoscope. But if I had the otoscope, I would gently place it in his ear, and I would most likely, in a normal ear, see a little bit of hair. I'd see a pink, what's that called? That alleyway in the ear. I'd see a tympanic membrane that is like pearly gray, and I think that's it. No, I'll perform cerebrum in the ear canal. It would be pink, and there might be a little bit of earwax and a little bit of hair. So now I have this tuning fork. I'm going to perform the Weber test and then the Rhine test. So I'm just going to engage this, and I'm going to put it on the top of the head, and then you're going to tell me where you hear it. Okay, ready? Do you hear it on that side, or middle?
Kind of over here.
Kind of over there? Okay, let me do it again. That's an abnormal finding.
In the middle.
It's in the middle? Are you sure? Do you want me to do it one more time? Andrew suffered a traumatic head injury a couple years ago, so.
In the middle?
It's in the middle? Okay, are you sure? Because if not, we have to go to a neurologist.
I think he's lying.
This side.
Okay. You felt it on this side? Alright, that's something we might have to get checked out. Now I'm going to do the Rhine test. So I'm going to engage this, and I'm going to put it here, okay? And you're going to tell me when you no longer hear it. Okay? And then I'm going to move it here, and you're going to tell me when you no longer hear it over here. Ready? This thing's cutting my hand. Stop. Stop. Okay. Do it again. We're going to do the same thing, okay? Tell me when you don't hear it.
Don't hear it.
Okay. Now I'm going to inspect the nose. So I'm going to palpate. Do you have any tenderness or anything feeling awkward or funny? And it's symmetrical, it's even, it's not crooked at all, but that can change as he grows older. And I'm going to look inside the nostrils, and I can see there's no flaring or anything, there's no drainage. And inside your little nose, there's a little bit of fine hair, a little bit of boogers, and it's pink and moist. Pink and moist, no flaring, no drainage. So the nose is in good condition. Now I'm going to palpate his frontal and maxillary sinuses. So I'll palpate. Any tenderness? Any tenderness? So if we were in a dark room, I could actually illuminate these, and they would show up bright and glowing because they're just like air pockets. And that would be a healthy sign, but I have to video record outside because of lighting, so we cannot do that. Now next I'm going to inspect the mouth. We're starting at the lips. His lips are pink and moist. There's no chapping. His is symmetrical on his face. Can you show me your teeth? I can see some of his baby teeth he's lost, and new teeth are coming in. Can I see it open your little gums? There's a little bit of food in there because he just ate, but he's gonna brush his teeth, and we'll probably go over some teaching. And open up. And he did have some cavities, I can see that. And his hard plate looks good, soft plate. Uvula is intact. It's midline. Can you stick out your tongue, please? Say ah. I can see his tonsils, and they're just normal size and pink. Everything's moist in there. Can you move your tongue that way? And up. And this way. And up. There's no lesions or anything funky in there. That looks good. Now I'm gonna assess Andrew's respiratory status, and you can't see, but I can see that his face is pink. He's not cyanotic at all. No signs and symptoms of cyanosis. He has no stress. His rate and rhythm of breathing is normal, and it's a normal rate, a normal rhythm. There's no stress. I would measure his rate for 1 full minute, assessing him, and normal is around 16 to 20, and he's about that, but I'll check that when I do his heart stuff. So I'm just going to palpate and see if there's any tenderness or something bothering him, or if there's any lesions or masses. You feel anything funny when I palpate you? No. Does this feel okay? Mm-hmm. I'm going to go all the way down. Nothing